And so where I want to go with this podcast now is to talk about what I hope to see in the pregnant and postpartum space in 2026. The first thing that I want to keep hoping to see more change towards, and this is going to be a wish list that isn't always going to be possible because I know that some of this is not possible in a social media landscape, but we're going to try the best we can. What I want to see in 2026 is a continued avoidance of this all or nothing, safe or unsafe messaging that has been so central to understanding or program marketing for pregnancy and postpartum. We see this a lot with our core messaging of like, this is a pregnancy safe exercise, or here's a modification that's safe for DRA, diastasis rectus. And we have this open acknowledgement that there is no such thing as safe versus unsafe messaging in pregnancy and postpartum. It is what is the exercise that the person that is pregnant is ready for versus the exercise that they are not, outside of anything that would cause a blunt force trauma to the abdomen, right? And so I am hoping that we are going to see this uptake and return to nuanced language that allows for more conversations to stay in the gray, where the recommendations that I'm going to give to a marathon runner who is used to a 50-mile a week exercise volume is not going to be the same as my mom of 4 who hasn't really returned to exercise in her pregnancy postpartum journeys because of life stresses and life demands, and is hoping to be active in this 4th pregnancy. Those situations, circumstances, not just from the muscles and bones perspective, but also from, the supports, the environment, the life, the expectations, the demands on your time perspective, are all going to require this individualized approach. Our postpartum recommendations very much started to pave the way for this type of understanding when it comes to counseling around pregnancy and postpartum, where in the postpartum period, there was an advocacy for a individualized symptom-based return to exercise protocol that is going to take into account the social determinants of health, meaning that somebody may be able to start returning to exercise 3 days postpartum, moving their body in some way, and others it's going to be a year before they're really back to any sort of dedicated physical activity